The good news is, the numbers of COVID-19 cases are plummeting across the country. But there is still a stunning amount of virus spreading in many places, with more than 100,000 reported cases a day. If you have a current infection, you might be wondering, just how long am I infectious? And when is it safe for me to step out and socialize again without risking getting others sick? The answer depends on whom you ask. According to guidance from the Centers for Disease Control and Prevention, you can exit isolation 5 days after a positive test or the start of symptoms, so long as your symptoms are improving and you keep wearing a mask around others an additional 5 days. However, this guidance comes with caveats. It's largely based on data from prior variants, and it was shaped by practical considerations, namely, how to make sure workplaces had enough staff to keep functioning at a time when Omicron infections were racing across the country. Meanwhile, emerging science suggests that, with the Omicron variant, as many as half of the people infected will still be potentially infectious on day 5, and some maybe for a few days beyond. What we know based on the data so far is we can't reliably use 5 days as a way to exit isolation. So how can you know if you are ready to rejoin the world, without potentially infecting others? Here are some science-based criteria that can help you figure it out. At least 3 studies have found that people infected with Omicron still have virus levels high enough to be contagious more than 5 days after their symptoms began. Researchers looked at data from the National Basketball Association's extensive COVID testing program. Their study found that around 50% of people infected with Omicron were still testing positive on a PCR test on day 5.